into aesthetics. How fun. This is up and coming, right? And this is something that optometry is getting more and more into, and it's really exciting because it's so popular right now. It's such a hot topic for patients, for people around the world. And also, it's such a great way for optometrists to set themselves apart, to do something different than the one or two things that we were taught, and a new space that we can really expand in. So I'm really excited to be talking about this. This is something that I'm into as well in my practice. So what are ocular aesthetics? So ocular aesthetics basically means this is a group of treatments that optometrists can do that have both functional and aesthetic benefits for patients. So they're not invasive procedures. They enhance both functional aspects and health and appearance. So basically, there's the functional aspect of it, and then there's the cosmetic aspect of it. And a lot of those go hand in hand. So think about it. If you have a patient with dry eye, let's say, a lot of their complaints are about my eyes are always red, right? Maybe not as much about the pain. Maybe they have discomfort also, but a lot of the time their complaint is my eyes are always red. And so that's a cosmetic complaint when you think about it. Obviously, the underlying cause is the dryness, but what if we could tackle both of those, the discomfort as well as the redness, right? There's a growing demand for aesthetic treatments as well. As I mentioned, this is a really hot topic right now. So let's talk about ocular aesthetics and optometry. We have patients that we can use this on, are patients with dry eye with meibomian gland dysfunction or MGD, with ocular rosacea. We know that dry eye is huge, right? As Dr. Lonsberry said earlier, all his patients in Alaska have dry eye. Everyone has dry eye until proven otherwise, right? Sometimes we see even younger patients, adolescents, children that have meibomian gland dysfunction, right? And if you really check and ask, like all this screen time that's being done, we are seeing more and more and more dry eye because we're looking for it. We're more aware of it now. So also what we want to do is reduce inflammation, improve the tear film stability, which is comfort, but it's also appearance. Okay. And so we also want to address when we're talking about aesthetics, the periocular aging. So, and the toxic makeup. So patients who say, you know, they have lid laxity, patients who have dark circles under their eyes, they have wrinkles. Those are things that we can address with our dry eye treatments. Pretty cool, right? And then we also want to talk about hygiene. So makeup, there's a lot of toxic makeup that have metals, that have chemicals, that have things that modify the endocrine system. So we really want to advise our patients not just on treatments that we can offer, but things that they can do at home as well, different products that they're using that could be harmful to the ocular surface. So again, when we're talking to patients, we want to make sure that we are offering things that can help them in the office, but that this work is continued at home. Consistency is key, right? And so we want to make sure that the treatments that they're doing, whether they're doing them in the office or at home, are ongoing. So just like, for example, a patient that you recommend something to, let's say like a hot compress, and a lot of them will say, yeah, I did that once and then I stopped doing it, right? They don't really do it. But think about it. If someone's going to the gym, wants to build muscle, if they go once, it's not going to do anything, right? So if you really want to see results, something you have to be consistent with. And so one of the things that we're getting more and more into in optometry is customization, personalization, making things for you. When you come in, like the patient comes into your office and wants has a concern, whether it's cosmetic or functional, you're designing something for this patient. And I find that personalization changes everything, right? Because everyone is so different. So, importance of follow-up treatment. So a lot of these treatments that we're going to get into have follow-ups, a series of sessions. So a series of sessions allows you to have multiple touch points with the patients, to see them often and to make sure to follow up, to see how they're doing, to see how they're feeling. So what's cool is that we can integrate these discussions into our routine eye exams. So we can talk about the functional aspect, like these are the treatments that we have for dry eye, but they can also help you feel and look better, right? And so you can also have like a designated consultation area. You can have an area where you talk to patients about what you're seeing and what can be done and how you can help them. So why now? Basically, This is a hot topic. There's been so much on social media, right, about aesthetics, about appearance, and patients are interested. The thing is that they don't know that optometrists can do this. So we're trying to fill that gap, right? This is our time to educate patients like, hey, like we can do this. And a lot of them had no idea that this was even related to optometry. For some reason, people don't relate like eye wrinkles or bags under their eyes or redness around their eyes to eye care. But it is completely connected, right? Now we know that there's a common annual growth rate of about 10% over the next few years, which is huge. We know that there's people who also want prevention, right? The younger patients that not necessarily don't have wrinkles yet, but they want to prevent. Like we see younger and younger patients getting into skincare, right? So these patients are also people who can be more proactive about doing things to prevent aging, right? Aging of the skin around the eyes. So what, how do you get patients into aesthetics? Like how do you choose these patients? Patients who have dry eyes. So remember, dry eye is so common. Almost everyone has dry eye, right? Concerns about periocular aging. Anyone over the age of 35 has some sort of concern about aging around their eye. Those who use anti-aging creams but still have complaints, people who are considering surgical procedures but they don't want to move forward yet, and younger patients who want to be proactive, as I mentioned. So this is a great specialty for us to have because it's cash pay. So we talked about cash and insurance a little bit earlier. Why is it better to have cash pay? Insurance is trying to pay us less and less, right? And honestly, it's unpredictable how much we can get, right? And it's not consistent. So it's restrictive. We know what we're going to get paid. Also, you're basically freeing up your staff time to do other things when they're not taking care of billing for all these patients, right? Another thing is that you get the revenue immediately. So that's great, right? And there's an ongoing demand. So this is something that is just going to keep getting more and more popular. As I mentioned earlier, a lot of these treatments, you do them in several sessions. So you will have multiple touch points with the patients. And basically, there's higher profit margins, right? So compared to, let's say, a pair of glasses or contact lenses that you're selling, the consumables are so inexpensive for some of these treatments that the profit is really, really high. So think about the fact that patients can shop around for glasses and contacts. They can get those anywhere. Whereas it's hard to find specialists who have this type of devices in their office and ones that are also specialized in eye care, right? So this is something that could be unique to your practice and a way that you can really set yourself apart. So how do you market for this? Basically, you have to talk to your staff. Okay, that's really important. If you're getting into this, you really have to get your staff on board. Explain what you're doing because they're the ones answering the phone, right? You're trying to build a brand, you're trying to build something new, something that wasn't really part of optometry before. So you can let all your patients know, like I send out newsletters, um, you can send out emails, you can have your own patients in the office, you can tell them, so you're basically marketing this to your current and new patients who are coming in the office. And again, this can vary by state, so make sure that you can actually do this. I think you guys can, right, in Arizona? Um, and then also informed consent. So patients have to be aware of what they're getting into. You don't want to overpromise anything, and you don't want to underdeliver, right? So you really have to set realistic expectations. So again, staff, right? Staff training. You want to be upfront about the cost. I think one of the worst things you can do is do a treatment and then, your patient's on their way out and they get this huge bill, right? So you want to make sure that they know the cost up front and that they know what they're getting into. You want to choose the devices that are right for your practice based on what you want to do, what you want to achieve. Are you trying to do more cosmetic? Are you trying to do more dry eye? Are you trying to do both? So you really have to see what fits, do some demos with different companies, see what you like. And then again, patients are not necessarily actively looking for aesthetics. Sometimes they are, but again, they don't know that optometrists do this, right? So one of the things that you want to do is introduce this aspect. And so some patients are more interested in the cosmetic portion. Some patients are more interested in the functional portion, right? But what if you could tell a patient, hey, I have something that's going to help treat your dry eye, but it's also going to help you look better, right? Or I have something that's going to help with the fine lines, but it's also going to help treat your dry eye, right? So those are the how you approach the situation depending on what the patient is looking for. So make it part of the patient journey. When they come into your office, have different things on the walls, maybe some brochures, maybe something in your intake form. Like, do your eyes feel tired? Do they look tired? Do you have redness? Things that address cosmetic complaints and also dry eye in your intake form all the way to the end of your appointment. So one of the things that I think is important is when you are considering treatments, you want to do something that's a little bit more on the eye care side of things. So for example, if you're considering a laser, right? I think it makes more sense to do something like IPL, which addresses also dry eye, than getting into like a CO2 laser, right? Or like a cosmetic laser. So something that's connected to eye care, right? And then you want to document thoroughly. You want to know when to refer. So if you see something unusual, if you see something that doesn't really like match, if the patient needs Botox or something else, like you have to also co-manage with other specialists. Who here does ocular aesthetics right now? Tammy. Anyone else? Yeah, so I think it's important to know, when to also work with other specialists, oculoplastics. Like, does a person have severe ectropion? Like, you're not necessarily going to fix that with a treatment, right? So you have to know when to refer. Also, always prioritize the patient before the profit. I think I don't need to tell you guys that, but that's important. If you feel like someone's just not benefiting from a treatment, that they're not going to benefit from a treatment, don't do it. Also, be upfront about the costs. Again, that's really important. Don't pressure anyone into unnecessary treatments. Give them realistic expectations. Like for those of you who saw us, we were doing the OptiLift earlier. We weren't saying this is going to get rid of all your bags. We were saying this is going to help with lid laxity, which it is, but you're not over-promising. So you want to be transparent. Every procedure has risks, so make sure that they know, make sure that they're filling out consent forms, make sure that they're informed. And then you will have to mitigate anything that happens after. So make sure that you know what those things are and how you can address them. So again, this is a growing field. It integrates eye health and cosmetic care, and you're addressing, again, medical conditions and improving periocular aesthetics. So on the left side is going to be the functional stuff, and on the right is going to be the cosmetic, right? So let's say we were talking about dry eye. We're improving ocular surface health, we're treating dry eye, and we're restoring eyelid function. But on the cosmetic side of things, with the same treatment, we're enhancing periocular appearance, addressing wrinkles, sagging, skin puffiness, redness. For chronic dry eye, MGD, ocular rosacea, eyelid inflammation, or if they have more cosmetic complaints, signs of aging, improved skin texture, correct pigmentation. And examples of these treatments would be IPL, RF, microblepharoexfoliation, and others. So for example, if you take IPL, you're improving ocular rosacea, you're improving inflammation, so that's all the dry eye stuff. But cosmetically, you're also improving periocular skin tone, right? For RF, you're restoring gland function because this melts the meibum in the glands, but you're also tightening the eyelid. So you're doing two things at once, right? Microblepharoexfoliation, you're reducing redness, irritation, but you're also giving the patient a refreshed look. How many people do microblepharoexfoliation here? Any BlephX or Newlids Pro? So you can see right away the patient feels better. It's like getting a blowout, right? It feels good. So they provide both functional and cosmetic improvements, bridging the gap between functional and aesthetic. and you're helping patients look and feel their best. So I'm going to go over the different treatments now, and all of these are evidence-based therapies for ocular aesthetics. They're non-invasive therapies that provide both functional and cosmetic benefits. They're all supported by clinical research. And why it's important to have evidence-based treatments, they're clinically validated to ensure safety, efficacy, and long-term benefits, and they have measurable improvements. So let's get into it. All right, so IPL. IPL is an FDA-approved treatment for dry eye management. It treats dry eye disease and ocular rosacea, originally used in dermatology for skin rejuvenation, okay? But what it does is it reduces inflammation, erythema, improves MGD, reduces inflammation, enhancing periocular aesthetics as well, okay? So what it does is it actually treats one of the underlying causes of dry eye. So one of the underlying causes of dry eye, as we know, is inflammation, right? And with IPL, we can actually address this. So when we talk about different treatments, upstream treatments like cyclosporin, like lifitegrast, we are treating inflammation. But what if you could treat the underlying cause of that? And what if the underlying cause of that was ocular rosacea? Well, with IPL, you can actually treat that, okay? So that's amazing, right? So some of the reason why you get clogging of those meibomian glands is because there's inflammation. Inflammation increases the melting point of that meibum, and so it doesn't come out as liquidy anymore. And so that's the reason why you have the clogging of the glands, and then you can get infections, right? Or you can get meibomian gland dropout, right? And so when you address the underlying cause of inflammation, then you can help prevent that. So how IPL works, it's a broad spectrum light pulses to target inflammation and abnormal vessels. Light energy is absorbed by hemoglobin, reducing abnormal vessels, which is telangiectasia, and it triggers chronic inflammation in ocular rosacea, dry eye disease. So basically, by reducing inflammation, IPL restores proper meibomian gland function, which is better tear production. So it's a game changer because it really treats the underlying cause. Any questions about IPL? Yes. For what? Oh, darker skin patients. Yeah, so I'm going to get to the contraindications in a bit, but when someone has Fitzpatrick, so basically darker skin that's type 4, 5, or 6, at that point you have to be a little bit careful with the IPL. You cannot use it. So in those cases, you have to target inflammation other ways. It's a great question. So omega-3s, also the upstream treatments like cyclosporin, lifitegrast, and things like that that can help with inflammation. Any other questions? So how IPL reduces erythema, so this would be cosmetic, right? It enhances periocular aesthetics by reducing redness, erythema, vascular lesions. And it stimulates collagen production, improving skin tone, elasticity, and overall appearance. So this is such a great treatment because it really helps patients feel better. They have less inflammation, and they also get the skin tightening, the collagen. So it's a win-win. And so depending on what patients are so happy when you have a treatment that not only helps them feel better, but something that helps them look better too. So it's typically 4 to 6 treatments spaced 2 to 4 weeks apart. Patients overall, they notice gradual improvement. So a lot of these treatments are cumulative. So basically, they might feel better after session 2 than session 1, and then they continue to feel better as you finish the treatment protocol. So maintenance treatments, you can do them every 6 to 12 months, depending on how severe it is. So common side effects, there's minimal discomfort, sometimes some tingling, heat. Patients should avoid sun exposure. And again, for very dark, so 5 or 6 skin tones, it should be avoided because of risks of change of coloration of the skin. All right, let's talk about radio frequency. So radio frequency is what I use now to melt the meibum. So it melts meibum really well, and it also helps restore collagen and elastin in the eyelid. So it goes a little bit deeper than a lot of our traditional heating and expression. And so it helps kind of regenerate some of the glands that are falling off out. So once you have complete meibomian gland atrophy, there's not really much you can do. But you know how sometimes you have those glands that are like a little deformed or a little bit falling out? You can actually regenerate that collagen and elastin. So it helps to liquefy the thickened oil in the glands. And then a lot of the time we do expression. Do you also do expression after your RF? So that helps really just get all that oil out. So a lot of the times we love to do both treatments because with the IPL we're reducing inflammation, and with the RF we're getting all that solid oil out. So it's like a double team. It's so good together. So for rejuvenation, skin tightening, so that's great. We just did RF on one of our attendees here, and you can see the before and after. So it tightens the skin through stimulation of the dermis, so encourages tissue remodeling and reduces fine lines. So again, you're helping patients look and feel better. So you're not just expressing their meibomian glands, you're also allowing them to have tightening of the skin. So addressing two issues in one. So you can see before and after pictures, and before and after pictures are a great way also to market your practice. So if you get into this ocular aesthetics, you can start posting before and after pictures, of course, with the patient's consent, and show the results, right? And patients love to see things like this. So basically, when you're using RF, it induces fibroblast activity, promoting synthesis of new collagen, enhances skin elasticity, and provides a natural lifting effect. Okay, so you can see up there an example of a treatment. Usually 3 to 4 sessions, typically spaced 1 to 4 weeks apart. Maintenance sessions again. So again, you're having multiple touch points with these patients, and it's really allowing you to follow up. And so one of the key things in dry eye is really the follow-up. And I think that using these treatments is something that really allows us to have multiple patient encounters and allows patients to really trust that we're taking care of this. So it's safe and effective. It can be used again standalone, or you can bundle it with IPL. Yes. Yeah, I feel so. The question was, is it typically that fast on the video? I think every device is a little different. I think every doctor is a little bit different. Some of these treatments are like 6 minutes or 7 minutes long. So I don't think it really matters. I don't think she's going too fast, but everyone has their own way of doing things. If you want to go a little slower, you can. All right, so for those of us who saw the DMST outside, that was pretty cool. So this is a little newer, and we did review this, but I'll go over it again. So we talked about RF. So this device has both RF and DMST. DMST is dynamic muscle stimulation. So RF, again, tightens the skin, it stimulates collagen, but DMST tightens periorbital skin, reducing eyelid sagging. It improves blinking function too, which could be helpful in dry eye as well. So it enhances overall facial contour and muscle tone. And what it does is, again, it stimulates the orbicularis muscle. Okay. So and we already know, again, what RF does. So we've gone over that. But what the DMST does is sorry. So gentle electrical impulses to stimulate facial muscles, increasing blood circulation, oxygen delivery, and strengthens the orbicularis muscle. So it addresses age-related eyelid laxity and things like that. So it helps with that. So one of them, again, stimulates the collagen production, and the other one really stimulates the muscle. Any questions about DMST? So you can actually do this with RF or not. So, low level light therapy. So it targets inflammation and reduces ocular surface stress. It emits specific wavelengths of light, typically red and near infrared, to reduce inflammation. So it helps to decrease pro-inflammatory cytokines. So again, with inflammation, and improves overall ocular surface health, and it's beneficial for patients with blepharitis, MGD, ocular rosacea. So the photo Biomodulation effects stimulates cellular metabolism, enhances meibum secretion. It aids in softening of the meibum. So again, this is a treatment that has a dual function. So it helps with inflammation, but it also helps that tightening. So you can see results with this. This is a very popular treatment. Patients can do it at home as well, or that's something that you can offer in your office. Usually the devices that are done in the office are a little bit more potent, and so they may not be done as often, whereas treatments that you do at home are done a little bit more frequently. So it stimulates mitochondrial activity, increasing ATP. That's how it promotes cellular repair and wound healing. Encourages collagen production, microvascular circulation, aiding in the recovery of ocular surface, and it helps in post-surgical healing and reduces oxidative stress as well. So delivered in 10 to 15 minutes. So it's a super short session, no downtime, and it can be combined again with other treatments like RF with IPL. Bye, Corey. So you can do initial therapy, which is 3 to 4 sessions spaced 1 to 2 weeks apart, and you can repeat it as needed every 4 to 6 months, again, depending on the severity. Patients are often really happy with these treatments, so they want to come back and do them again. Yes. Sorry? No, no, I haven't seen that. I'm not sure what that one is. Tammy, do you know what that is? The three lights? Okay. Okay. For the LLT that you do in the office? Okay. Okay. No, I haven't seen that one, but that's a good question. Yeah, I think it's just different devices have different wavelengths that you can choose from. So microblepharoexfoliation is something that we do to remove debris off of the eyelashes. So this is a treatment that works really well to remove collarettes, that removes scurf as well. So great for patients with anterior blepharitis. This is a patient that, again, patients will feel refreshed right away, and you want to give them something to do at home as well to keep this going. So you want to make sure, but look at the difference in appearance also. So this isn't considered ocular aesthetics as well, because you're helping the patient feel better. Again, patients who have a lot of collarettes, patients who have debris in their eyelashes, you can see that it looks inflamed, it looks red. So if you can remove that right away, and obviously there's other treatments. It's not a standalone treatment because it will recur if you don't treat the underlying cause. But it's important to make sure that they're using treatments that you recommend. So typically takes 5 to 10 minutes, sometimes less. It's not uncomfortable. I usually put some proparacaine in before I do it. Patients are really happy, and what's cool about this is you can show them the before and after pictures again if you have a slit lamp camera or even a phone, and you can really see the difference. Lid hygiene is really important. As I mentioned earlier, there's a lot of toxic substances that people are using around their eyes. One of the things that I do is I ask patients what they use to remove their makeup at night, and a lot of them don't remove it at all. And as gross as that sounds, it's really true. So I think, telling patients that the soaps that they use to clean their faces are not getting rid of what's in their eyelashes. And I think it's like you can brush your teeth, but you're not necessarily flossing. You're not getting rid of everything. And so it's really important to mention that they have to remove the makeup. And also I love to give them products that do that effectively and not just makeup removers. So recommend gentle, non-irritating cleansers for the eyelids, etc. Hypoallergenic, preservative-free, fragrance-free products. Avoid waterproof mascaras also. A lot of those just don't come off ever. And educate on hidden irritants in skincare like retinol and stuff like that that can get in the eyes and burn. So there's so many products available. I think it's important to choose ones that you like. Have your staff try them too, and get on board with like a few products. Make sure that your patients are either leaving with them because you have them in the office, or that you're directing them somewhere where they can find them, where they're not expired and where they're not counterfeit. A lot of times you'll get patient questions, and I think this is a great slide because you can really see common patient concerns. So, is a treatment safe? I think that's like the primary questions. All of these treatments are either FDA cleared or FDA approved, which means they've been shown in studies to be uh, to work really well, to be safe and effective. There's no significant downtime also. How effective? It works really well. A lot of our, you can have before and after pictures. Again, all of these have been shown to be beneficial in studies. Um, I had a patient last week, she was worried about the IPL. She said, you know, if this is anywhere, if there's any way this could damage my eye, I don't want to do it. And so I told her, no, you're going to be wearing eye patches with, you know, glasses on top. Like there's no way. And so I think reassuring your patients and like really understanding what their concerns are is important.